Hello, everyone, and welcome to Arthritis Talks, Strategies to Manage Your Pain. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Society, and I'd like to welcome all of you joining us today as we kick off Arthritis Awareness Month. Every day, we receive countless of questions about pain from Canadians living with arthritis. In fact, studies show that it's often their number one concern. That's why we're here today, to answer the most common questions about pain and pain management, as well as many of the questions we receive about medical cannabis as a possible pain management option. Our two experts today are very well versed on these topics, and we're sure you will find their presentations informative. Before we get underway, just a few logistics. This webcast is best viewed on a laptop or desktop computer. If you do have a question, you can submit it through the Q&A section at the top right of the screen, or you can email arthritistalks@arthritis.ca. We will try to get to as many questions as possible during the hour we have together. Thank you all very much who sent questions in advance. It's really helped us to shape today's presentation. You can click on the chat window on the right of the screen to connect with other participants and the Arthritis Society's chat moderator. Let's get started. We, the Arthritis Society, is Canada's national charity dedicated to creating a world where people are free from the devastating effects of arthritis. We do this by funding research, by advocating to governments on your behalf, and by providing timely, evidence-based information and support to help you live a good life. As I mentioned earlier, September is Arthritis Awareness Month, and we encourage you to join the movement as we raise $1 million and 1 million voices this month for the 6 million Canadians living with arthritis. I'm pleased to welcome physician Dr. Danial Schecter and Helen Stevenson, founder and CEO of the Reformulary Group, to speak with us today at Arthritis Talks. Many of the questions we received in advance follow similar themes, so they're going to address them through today's slide deck, and then we'll have time for additional questions at the end of the presentation. Today, we'll provide an overview of pain, some evidence-based strategies for pain management, and discuss medical cannabis and its potential use in chronic pain management. Before we get started, I want to take a moment to thank our event partners, Apollo Cannabis Clinics, our exclusive cannabis sponsor, who you have the opportunity to speak to at their virtual information booth following the event. In addition to the support of Apollo Cannabis Clinics, this event is also funded in part by the Government of Canada's New Horizons for Seniors program, United Way Winnipeg, and the province of British Columbia. So let's get started with our first question. Dr. Schecter, welcome. We know that pain is complex and there are many different facets. So can you help us and give us a little bit of an overview of what is pain with respect to arthritis and what makes it so complicated?
Absolutely. Thank you so much, Sean, for inviting me for Arthritis Talks, and I look forward to participating in the Arthritis Awareness Month. Let's talk a little bit about pain. And why is it that we're talking about pain? Well, pain is really the number one reason that patients are concerned about. It's the number one symptom that they go to their doctor and complain about. By patients who are living with arthritis. And it doesn't matter what type of arthritis, whether it be osteoarthritis or rheumatoid arthritis. Usually the common denominator is pain. So what is pain and how does it affect us? Well, we know that pain is actually something that is meant to protect us. If we think about different reasons for having pain, it's because we have injured ourselves. And if we think about ourselves breaking a bone, we'll get pain from that. And pain will actually protect us because it will prevent us from re-injuring ourselves. If we're in pain because of a broken bone, we're going to stop using that arm or that leg. So in a way, pain is very protective. But that is when something happens acutely. And people who are living with arthritis are often having what we call chronic pain. And chronic pain is different than acute pain. Acute pain is something that occurs because of a direct insult or injury to our body. And chronic pain happens when we are living with pain for a long period of time. And we can have pain that is different types of pain. There's pain that is often described as neuropathic in origin, meaning that it's often described as having a burning, numbing, tingling sensation. But there's also pain that is what we call nociceptive, meaning, and more so relating to arthritis, meaning joints being involved, inflammation happening. And this is the most common type of pain that is experienced in people who are living with arthritis. And we also have visceral pain, which is really that pain that comes from your organs. If you're having appendicitis or gallbladder pain, that's what we talk about when we talk about visceral pain. And it's important to understand as well that pain is not just something that is found in your joint or in your hand or in your foot or in your elbow. While pain does originate from some type of insult or injury to nerve endings that are found in your joint, your muscle, your tissue, it's actually your brain that is interpreting those signals. And it's your brain that experiences the pain. And that's why no matter what type of pain that you're experiencing, no matter what reason that you have for developing pain, whether it's arthritis, whether it's a surgery, whether it's cancer, the commonality between all of this is that your brain has to interpret that type of pain. And the way that we can manage pain is not only by providing you with things such as medication to reduce the inflammation at the site of injury, but we can also give you some medications and also different techniques to help your brain change the way that it perceives pain and allow you to live with pain in a bit more of a manner that allows you to get on with your day. And I think it's important that people understand, people who are living with pain understand that the role of a pain management regime is not to completely eliminate your pain, but to make it so that it is controlled enough for you to be able to live the life that you feel brings you joy and happiness and fulfillment. Can we get the next slide, please? Now, we also have to remember that pain is not something that people experience in isolation. Pain is really something that has many frequent, what we call comorbidities, because pain is often what sets off what we are calling the pain cycle. If you have some pain because of a disease state, such as osteoarthritis, it's going to cause you to be able to do less activity. It's going to be able, it often translates into increased stress in your life because you have to go and figure out how you're going to do your daily activities with that pain. You have to go visit doctors. You have to take medications, potentially get injections. And often all of the stress and anxiety that surrounds someone who is living with pain will lead into developing conditions such as anxiety or depression. And often these symptoms of anxiety and depression will keep you up at night. People tend to worry. And also pain is very frequently more experienced at night and prevents people from sleeping. And then they have trouble sleeping. And the next day they're more fatigued. And because you're more fatigued the next day, we often say that someone's pain threshold, the level at which they will experience pain, has been reduced. And for that reason, they have increased pain the next day, and the cycle goes on and on. So we have to remember that pain does not live in isolation, and a proper pain regime or an approach to someone living with chronic pain due to arthritis has to be what we call multimodal. Can we get the next slide, please? It should not just be using something to manage or reduce the amount of pain at the site. It has to be all encompassing. And this is so important because we know that the pain cycle is a vicious cycle. Because when you have more pain, you have limited activity. And if you limit your activity, there's a chance of gaining weight. There's a chance of developing more chronic illnesses such as diabetes, heart disease, and stroke. This can lead to a loss of productivity or loss of being able to provide care to yourself and to your loved ones. It also means that you're going to be able to get out less into the community, interact with your friends and your family. And you might have to live in a situation or in a long-term care facility because you're no longer able to care for yourself. And this, unfortunately, causes a negative spiral of health. And that could potentially lead to what we call dependent living, meaning living in a care facility or being dependent on other people. And it also has a chance of causing an earlier death. So it is incredibly important that we not only understand what pain is, but we have to understand that pain has an effect on so many different parts of our life, on our enjoyment of life, on our activity, on our broader healthcare. And we have to develop strategies in which to address all of these issues to prevent the short-term and long-term complications that come with living with chronic pain. Can we get the next slide, please? So we mentioned that a proper pain management regime or an approach to pain management should not just be focusing on what your doctor can do for you. It should not just be focusing on medications or injections. A proper pain management program will involve many different types of activities that you can do on your own with healthcare providers or in consultation with a physician or nurse practitioner. First of all, it's incredibly important that no matter what you do, no matter how much pain you have, you continue to stay active. And that means that exercise is incredibly important. For people who are living with arthritis, often aquatherapy or exercise in a heated pool can be incredibly beneficial to maintain your strength, maintain your endurance, and promote flexibility. Different techniques people have also developed include using heat and cold. Making sure that you have proper posture is also important. So these are some of the physical things that can be done on your own or with a physiotherapist or occupational therapist. But it's also important to remember that pain is not something that is just physical, that it is also something that is very much in your brain. It's your brain that interprets pain, and it's your brain that allows you to either live with pain easily or suffer with that same pain. And that's why there is an incredibly robust body of evidence that is really looking at using the power of the mind to help people live with chronic pain. And that is one of the reasons why people who are involved in pain management are so focused on helping people develop strategies such as mindfulness, such as meditation, to help them cope with pain. This can be as effective, if not more effective, than some medications. And of course, we have other ways of managing pain, such as physical therapy, occupational therapy, massage therapy, which can all be beneficial, but are only one piece of the puzzle. And lastly, medications that doctors can provide or nurse practitioners, again, they're one piece of the puzzle, but if you are only relying on those, I urge you to really find other techniques such as exercise, mindfulness, meditation, physiotherapy that can really help to help you live with your chronic pain. Can we get the next slide, please? So often people are asking me, you know, doctor, I want to learn more about chronic pain, but when I go on the internet, the amount of information is just overwhelming. Are there any sources? Are there any trusted sources that I can go to? And I want to remind everyone that the Arthritis Society is an organization that is held in very high esteem, that relies on experts from across Canada to provide them with appropriate medically approved content. And there are a number of resources on the Arthritis Society website that can help you learn more about pain management resources. The Arthritis Society is happy to host online learning modules, pain management and medications content hub, and they even have a magazine, Flourish, which can provide you further resources, including videos that you can follow along with. Next slide, please.
So thank you, Dr. Schecter, for all of that information. There was a lot covered there. We are always flooded with questions from registrants and from patients about medical cannabis, in part because we know that so many people obtain authorizations for their arthritis symptoms. Can you tell us a bit more about medical cannabis and whether it can in fact help with arthritis?
Absolutely. You know, I've been privileged to work within the medical cannabis sphere for the past dozen years, and people who are living with chronic pain are the #1 patient population that are coming looking for help to manage their symptoms. Can we get the next slide, please? And the majority of people who are using cannabis for chronic pain are doing so because of underlying conditions relating to arthritis, whether it be osteoarthritis, rheumatoid arthritis, or other types of arthritis. So what is medical cannabis? So broadly speaking, medical cannabis represents a group of products that are derived from the cannabis plant and are used under supervision of a healthcare practitioner, whether it be a doctor or a nurse practitioner, with a therapeutic intent, meaning to help manage symptoms, and not just being used for recreational purposes. So medical cannabis represents a broad range of different products. And all of these products are derived from the cannabis plant. But the cannabis plant is not a simple plant. It has many different compounds in it, but it has 2 compounds that are found in higher concentration than all others and are really thought to be responsible for the vast majority of physiologic effects on patients. These 2 molecules are THC, or tetrahydrocannabinol, and CBD, or cannabidiol. And it's important to understand that these are 2 very, very different molecules, and they can be used either independently or in conjunction in order to treat different symptoms. And it's important to understand in general what THC is and what CBD is. THC is that molecule that is responsible for the euphoric effects of cannabis. That means that THC is what recreational users are looking for, and that's why they consume cannabis. So THC does make you feel high, as the kids call it. But we also know that at lower doses, THC can be beneficial to help modulate our perception of pain. It can be beneficial to help reduce muscle spasms, to help increase our appetite, to decrease nausea, and to help eliminate vomiting. And I really want everyone to be aware that if you're using THC for medical purposes, you do not need to experience being high or impaired in order to get the benefits. So what is CBD? Now that we know what THC is, CBD, or cannabidiol, is another molecule that is found in the cannabis plant. And CBD does not cause you to feel high or euphoric. CBD, you can take a whole bottle of CBD and you're not going to be impaired. So why do we use it? Well, there's a developing body of research looking at CBD, and we have found that CBD actually has some significant anti-inflammatory effects. So people who are living with chronic pain, because they have inflammation in their body, potentially because of arthritis, if they're using CBD as an anti-inflammatory, it may be sufficient to help reduce their pain. We also know that CBD has an anti-anxiety property. And that means that people who are living with chronic pain, who have developed anxiety because of that, might have improvement in their pain because they have less anxiety, they have less inflammation. And something else that's very interesting about CBD is that we have found that it has the ability to increase someone's pain threshold, meaning that what causes you pain at the moment, if you use CBD, you might not experience the same intensity of pain. So CBD has a broad range of applications. And something else that's very interesting about CBD is that it has the potential to reduce some of the side effects that you get from THC, such as that feeling of being high or that feeling of impairment. Can we get the next slide, please? So many people come and ask me, if I use medical cannabis, is it going to cure my arthritis? Is it going to allow me to get off all of my other medications? So we know that medical cannabis is not what we call a disease-modifying drug. It will not change how quickly your disease progresses, but it does help manage symptoms of your underlying condition. It can help with pain. It may help with associated complaints of increased anxiety, depression, poor appetite, nausea, sleep. And what is interesting and what's really exciting about medical cannabis from a physician's perspective is that we are able to combine using medical cannabis with almost all other medications that are commonly used for chronic pain, because it acts very different and it's actually quite safe to add into your existing medication regimen. But as we had also mentioned a few moments ago, it's important that medical cannabis not be used in isolation, meaning that it has to be part of a comprehensive treatment regime that will hopefully include physical therapy, weight management, medications, mindfulness, and meditation. And we also know that medical cannabis is not for everyone. We do not generally recommend using medical cannabis for acute pain, for when you have just a cut or a burn. It's really meant to be used for people who have a chronic medical condition that is causing them pain. And we also tend to avoid using cannabis in people who are under the age of 25. Can we get the next slide, please? So how does medical cannabis actually help? Well, we know that medical cannabis, because of it has both THC and or CBD, can have a number of different effects on the human body. First of all, both THC and CBD may have a role directly in pain and how our body or our brain perceives pain. Both THC and CBD can also decrease the amount of inflammation that is causing pain. And what's interesting to me when I talk to patients and I see them after they have started treatment with medical cannabis, invariably they tell me that cannabis does two things for them. And this is really more so if they're using low doses of THC. They'll tell me, doctor, cannabis will reduce my pain maybe by 30%. It'll bring it down from an 8 out of 10 to a 5 out of 10. But the other thing that it does for me is that it makes me not mind my pain so much. It allows me to concentrate on things other than my pain so that I can be there and enjoy time with my family. I can take care of my grandchildren. I can prepare dinner. I can do my housework. So this is something that is really not seen in most other medications. Most other medications are purely just targeting the source of pain, but it seems that low doses of THC can not only help manage pain, but also manage our perception or how bothered we are by the pain. And as we said, cannabis has properties that can help manage both acute and chronic pain, and usually acute pain when it's relating to a flare-up of an underlying chronic pain. And we also know that cannabis has a potential to help reduce anxiety. It can really be useful for people who have difficulty sleeping at night because they're focused too much on their pain or because they are having insomnia. And we also know that people who are living with arthritis are often on many different medications, and this can cause significant gastrointestinal side effects, including nausea and vomiting. And cannabis may help with nausea. It may help stimulate your appetite if you are experiencing a low appetite. Can we get the next slide, please? Now, many people, and this is what I do many days of the week, is to help people determine whether medical cannabis is a good option for them. And first of all, I want to say that cannabis is really an option for most people that have failed what we call first and second line therapies, meaning that if you have chronic pain and you have never even given Tylenol a fair chance to work, we would recommend using something that has been better studied, that has a better understanding of its effects on the body, especially the long-term effects. And we generally recommend that people try at least one or two different medications before they consider a trial of medical cannabis. But many people, for different reasons, are not able to tolerate traditional pharmaceutical options. Very frequently, they're not able to tolerate Tylenol because they have problems with their liver. Or Advil, they're not able to tolerate because it has effects on their kidneys or their stomach. Many people are very against even trying opioids because of its very significant potential for long and short-term side effects and adverse events. So for these people, medical cannabis might be an option even sooner. And usually we do recommend that medical cannabis is an option for those people that have chronic pain, but especially so if they have chronic pain and associated symptoms. Those symptoms, again, can be anxiety, difficulty sleeping, nausea, vomiting, spasticity in their muscles. And the people who I see respond the best to medical cannabis are those people who have chronic pain and associated difficulty sleeping and anxiety. Can we get the next slide, please? Now, while we just talked about who medical cannabis is appropriate for, we have to remember that medical cannabis is still a drug. It is still a pharmaceutical option, and that means that it can potentially have side effects. And that means there are some people who should not use cannabis, and that includes people who are under the age of 25, those who have a previous allergic reaction to cannabis or cannabis products, and women who are pregnant, breastfeeding, or planning on becoming pregnant. And we also have a number of people who we might be authorizing or recommending cannabis with caution. And those are people who might have a history of psychotic illness, such as schizophrenia, those who have a history of a substance abuse disorder, those who have unstable mental health conditions or unstable cardiac disease. And this is something that is best assessed by a physician. Can we get the next slide, please?
Great. So thank you so much, Dr. Schecter. Helen, I want to bring you into this conversation now and elaborate a little bit about what Dr. Schecter was talking about. We know that many people are uncertain about whether they should be taking medical cannabis and have questions about how to access it safely. And I know that's something that you've thought a lot about. So could you give us a sense and a little bit of a summary of how you would consider people to access medical cannabis safely?
Sure, thank you so much, Sean. So if you just go to the next slide, please. So a few thoughts here. So first of all, what's important is to speak to your healthcare professional before first accessing medical cannabis. Just as Dr. Schecter said, there would be, in some cases, drug interactions and also some people that may be less appropriate to try medical cannabis. If needed, you could be asked to be referred, for instance, to a reputable clinic. For instance, there would be many clinics in different provinces across the country, and certainly here in Ontario. Another is an online tool that I'll speak a little bit more about in just on the next slide, called Cannabis Standard, something that we've developed that is a tool that's intended to help people interested in medical cannabis assess whether it could be an appropriate therapy based on the evidence, and then provide you with the paperwork, for instance, to have that discussion with your healthcare professional. With respect to healthcare professionals, and again, Daniel addressed it as well, they will do an assessment to determine if it is medical cannabis is an option for you. And then once you have that medical document, the medical document is essentially the authorization that is needed to have your healthcare professional sign. Once you get that, you can either purchase your medical cannabis from a licensed producer or otherwise choose to grow your own. Next slide, please. So how are recommendations determined? So let me just give you, or spend a minute here just to give you a little bit of background on a platform that we've built called Cannabis Standard. And this is really built by experts. In fact, Daniel, Dr. Schecter has been on our expert committee along with 4 other clinicians as well. And what we really did is looked at the evidence to use medical cannabis from around the world. We looked at evidence related to specific conditions, but probably more importantly related to symptoms. So for instance, pain related to arthritis. And use that to really inform a set of criteria around the specific symptoms and conditions, when to use it, which is what we call lines of therapy. So do you use it first or second, for instance? What types of products, what dosing, etc. And so the other thing that in building Cannabis Standard, our committee advised us on too, was how to capture the data with respect to real world data related to the impact of using medical cannabis on a patient's own symptoms. And so that's something that the committee, advised us heavily on, and which is incorporated in the platform. So there's really 4 tools that are part of this. One is a discovery tool, as I mentioned, which is really intended to help an individual determine if medical cannabis is, may be an appropriate option. And again, the maybe really relates to the fact that it's important. You need to have that conversation with your healthcare professional. There's something that we actually just launched today called the Cannabis Standard Index, which is essentially a way to be able to determine what specific product or cannabis could be, is comparable to another, for instance. So in the prescription drug world, we often know that one drug could be substituted for another, for instance, or is similarly effective. And so this is really intended to help guide that. Then there's tools to track your health. And then this fall, we intend to launch a platform called Clear on Cannabis, which is really a public awareness or public education platform whereby people can come in and ask questions and we'll get the answers. So not just from ourselves, but from a range of medical experts. So next slide, please. So let me just speak a minute about with respect to how much it cost. So the price is dependent on the specific strain, the dosage that you're taking, the format, for instance. So are you inhaling it, for instance, vaping it? Are you ingesting it, taking it as an oil, for instance, or is it a topical? So perhaps a cream. The price is also dependent on each licensed producer. The average cost has come down quite a lot in the past couple of years. And so the average monthly cost of medical cannabis right now ranges between $50 and $300. And again, you might say, why such a big range? It really is because of the few points that I made earlier: the strength, the dosage format, and again, each individual licensed producer would price differently. So some companies, although very few, but some companies do offer coverage for medical cannabis either as a medical benefit, so similar to, for instance, vision care or paramedicals, or otherwise through a health spending account if the organization offers a health spending account. It can also be claimed as a medical expense when you're filing your taxes. But again, there isn't yet, although I think that's something that as we start to build evidence for medical cannabis, employers may be more open to consider it in a larger number covered in the future. Next slide, please. So some online resources, where to find them. So a couple outlined here. So one, for instance, Health Canada has quite an extensive amount of information. You'll see here a screen capture showing you specifically where you can go in and read about accessing cannabis for medical purposes. The Canadian Public Health Association has what's called a Cannabasics guide, and so that can be accessed online as well. If you then, next slide please, with respect to just continuing where else to find resources online. So again, the Arthritis Society themselves have an online learning module, a medical cannabis content hub, and a magazine called Flourish, with Daniel mentioned previously. So those are some additional resources as well that are available online. So next slide. Just a couple of others, so some arthritis partners of arthritis partners rather. So one, and you may be familiar with, the Canadian Arthritis Patient Alliance. There's also the Canadian Rheumatology Association, and then other leading clinical and industry partners. So certainly some of the licensed or many of the licensed producers would have information with respect to medical cannabis and specific resources. So next slide, please. And back to you, Sean.
Great, thank you so much, Helen. So clearly safety is a #1 concern for us and for patients. So can you give us a little bit more information, Dr. Schecter, about how can patients access medical cannabis safely, and how would you recommend they use it?
Absolutely, thank you, Sean. So safety is not only the #1 concern from patients, it's also the #1 concern from physicians. And that's also one of the reasons why we are increasingly being interested in medical cannabis, because it has been shown to have a very good safety profile. Next slide, please. While we know that it has an excellent safety profile, it is still a pharmaceutical medication that does have the potential to cause side effects and adverse events. And for that reason, the #1 way that you can be safe in using medical cannabis is by ensuring that the first thing you do is speak to your healthcare practitioner, whether it be your physician or nurse practitioner. And that way they'll be able to provide you with recommendations on how to find your lowest effective dose for medical cannabis, and that means that it is the dose that will give you improvement in symptoms without unwanted side effects and adverse events. Usually, to find your lowest effective dose, we will recommend that you approach what we call a start low and go slow approach. And that means that you would start at a very low dose and you would increase every couple of days until you find the dose that is right for you. That's the dose that gives you improvement in symptoms without unwanted side effects. And if you do see a physician and they're not quite sure about what kind of a dose you should use, it may be worthwhile to request a consultation with a physician who has specific or dedicated expertise in medical cannabis. So it's not only important to follow the recommendations, or what we call the titration schedule, to find your lowest effective dose. Other things that you can do to help yourself is by keeping a journal, and a journal that will allow you to track your use of medical cannabis, but also your response, so that you can look back and say, oh yes, I did use 5 milligrams of CBD and 5 milligrams of THC. And that day I was able to do more. I was able to go for a much longer walk, and I was able to take care of my grandchildren for 2 hours. Another way that we often limit the potential of developing side effects when starting someone on medical cannabis is by recommending a product that is high in CBD and has little to no THC. And that's because CBD really has very few, if any, side effects. And most of the side effects that are attributed to cannabis are due to the THC component. And the amount of side effects is really related to the amount of THC that you are consuming. I also want to let everyone know that in general, there are 3 different ways that you can use medical cannabis. You can either ingest it, meaning that it comes in different formats so that you're able to eat it. The most common format is our THC and CBD being diluted into a food grade oil. The oil, it often comes in a bottle, and every milliliter of oil has a specific concentration of THC and CBD that's measured in milligrams per milliliter. You'll take that oil, you'll take a syringe, and you'll draw up the appropriate amount, you'll put it in your mouth, and you'll swallow. But these oils can also be put into a capsule, and each capsule will have a specific amount of THC and CBD, and then you'll take it just like you would take any other medication. These oils can also be put into a spray bottle, so that all you have to do is spray 1 or 2 or 3 sprays into your mouth. Now, we often recommend that ingested formats are going to be the mainstay of most people's treatments, because these only have to be dosed 2 or 3 times a day. They have longer duration of action, and the amount that is in your body usually stays even throughout the day. And usually inhalation is only recommended for what we call breakthrough symptoms or symptom exacerbation. So if you have chronic pain, but you do a lot more and you have a spike in your pain, that's when we might consider inhalation, because that has an almost immediate onset of action, and the duration of action is much shorter. And if you are going to be inhaling cannabis, we strongly recommend that you avoid smoking. Smoking anything, whether it's tobacco or cannabis, is dangerous and can be harmful to your health. We recommend that you consider using a machine that is called a vaporizer. And the last method of administration that is possible to use is topical application of cannabis creams or ointments. This can be very effective for certain individuals who have localized pain in a specific joint or area. They can rub it into their the affected area and get quite nice relief. Can we get the next slide, please? So we talked about the fact that medical cannabis really is a pharmaceutical option. And just like any other pharmaceutical option, it may have side effects. And it's important to understand that the side effects, as we had mentioned, are usually due to THC and are experienced in what we call a dose-dependent manner, meaning the more THC you consume, the more effects you are going to have. Now, the good thing is that if you start at a very low dose and slowly titrate or increase up over a period of approximately 2 weeks, those side effects usually go away and are very well tolerated. Very, very few people actually will discontinue treatment of medical cannabis because of side effects. And usually that's somewhere between 2 and 5% of people who will discontinue medication because of side effects, whereas other commonly prescribed medications, that can be upwards of 30%. We see that medical cannabis can be quite safe and well tolerated. I also want to mention that CBD on its own with little to no THC is extremely well tolerated and rarely has any side effects. Side effects that you will experience from THC include dry mouth, dry eyes. If you inhale it, you might cough. You can have a feeling of impairment, which could be a change in perception of time or impaired judgment, dizziness, lightheadedness. You can also get a rapid heart rate or increased feelings of anxiety. The good thing is that if you take too much, all you have to do is go to bed, and in a few hours, those symptoms will have dissipated. Next slide, please.
So thank you, Dr. Schecter. In the current world that we're living in and with the ongoing pandemic, are there any special considerations that people should take when it comes to arthritis, pain, or medical cannabis?
That's a great question. Can we get the next slide? You know, there's no difference between using medical cannabis during the pandemic than before or hopefully after the pandemic. Medical cannabis is one treatment option among many. But for all people who are interested in looking at medical cannabis as a potential therapeutic option, I strongly encourage you to visit your healthcare practitioner in order to discuss medical cannabis, get recommendations, or get a referral to a well-reputed cannabis clinic. And one of the things is that, you know, often people do not want to use cannabis, and especially THC, because it's a possibility of causing impairment. And we recommend that people do not drive. And in actuality, the pandemic might be a really good time to try cannabis because most people are staying isolated at home, are avoiding working, or avoiding driving, or other activities that might require significant attention. So this might really be a good time to try medical cannabis. And of course, under the recommendations of your doctor and in conjunction with a comprehensive treatment plan that includes mindfulness, meditation, physiotherapy, and potentially other medications. There's also been some talk about people saying that medical cannabis might be a cure for COVID. This is not something that is based at the moment in any actual science. There's some or I should say clinical science. There is some basic science being done in laboratories about the potential role of various components of cannabis to have an effect on the COVID illness. And the last thing that I want to mention is really to reinforce the fact that COVID-19 is a respiratory illness. And that means that if you are using cannabis, it is incredibly important to avoid smoking anything. And if you are going to be using inhaled cannabis, please do so in the form of a vaporizer. Next slide, please. And of course, if you do need medical care, either on your own or because you're having a significant side effect to medical cannabis, it's important that even during the pandemic, you do not delay or avoid calling 911. Hospitals and emergency rooms are open 24 hours a day, 7 days a week. And if you have any concerns, please go to your emergency department. If it is not an emergency, please speak to your healthcare professional who will often be able to contact you either by video conference or by telephone. There are many companies now and doctors' offices that have created the ability to see patients via virtual care. And that means that there is no reason why you should be limited or restricted from seeing a physician or a healthcare practitioner during this very strange time. And can we get the next slide, please? that brings us close to the end, and I'll pass it over to Sean for our Q&A session.
Thank you, Dr. Schecter. So let's take some questions that we've had through the chat box today. We've had many, so we'll get through as many as we can. Dr. Schecter, I think the first few are for you. One question, how often should you reassess the pain medications you're taking for arthritis?
That's a great question. And it's important whenever you're using any medication for chronic pain or for arthritis that you do so under the supervision of a physician. When you initiate someone on a medication, you're going to see them much more frequently. It could be every 2 weeks, every month, or every 2 months. But if someone has been stable on their medication and they've been using the same medication for a year or 2 years, it may only be necessary to reassess those every 3 months, 6 months, and some physicians might even feel comfortable going an entire year. But it's important that if you have any change in your condition or any change in your response to the medication, that you go and speak with a healthcare provider in order to be reassessed. Okay.
So why does the degree of pain vary throughout the day, regardless of what people are doing? And in particular, there are several questions and comments about why does pain seem to be so much worse at night?
Yeah, so this is a great question. And when we were talking about what pain is, we talked about the fact that pain is so much more than just a physical sensation. We know that people who are living with pain, if you have the same injury, you can either be bedridden because of pain, or you could be living your life absolutely normally. And that's because other factors might affect how we interpret pain. It could be stress, it could be weather, it could be physical activity, it could be what we eat. Many people have different triggers for having pain flare-ups. As for why people experience pain more so at night, this is largely because at nighttime, when we're lying there, the pain doesn't go away. We have the same pain that we had during the day, but we're just not doing anything else. And we're lying there, and instead of being busy and thinking about how am I going to drive to, what route am I going to take, or what am I going to make for dinner, or what should I pick up at the grocery store, or how should I solve this problem at work, the thing that you have to worry about or think about is, oh my gosh, my leg is hurting me and I cannot move over, I can't get comfortable. So it's really, really important that when I see someone with chronic pain, that we don't just address their daytime pain, we also address their nighttime pain and provide them with a better quality of sleep so that their pain threshold or their coping mechanisms are that much better the following day.
Okay. So we get this following question a lot, and that is, I approached my doctor about medical cannabis and they didn't want to talk about it. What should I do? Dr. Schecter, do you want to start with that one? And maybe Helen, I'll let you chime in there as well.
Absolutely. Now, about 85% of doctors in Canada are just not at all aware of the medicinal benefits or potential of medical cannabis. And physicians, you know, we're a pretty proud lot, and we don't like to admit that we don't know things. And it's easier to tell someone, oh, no, there's nothing to that, instead of actually taking the time to go to a seminar, to read a book, to speak to our colleagues, and learn about medical cannabis. So it's not because that they don't want to talk about it, it's really because most frequently they don't have the knowledge. And if that is the case, I would encourage you to be prepared to have a conversation with your physician, to explain to them, listen, doctor, the medications or approaches that we've been taking thus far have been limited in terms of their success, and I really do want to explore other opportunities. I had the chance to look on the internet, and I was reading about some scientific studies that support the use of cannabis, especially for pain. And maybe you would even print 1 or 2 out and bring it to the doctor and explain that I understand that this is something that you may not be aware of or comfortable talking, but there are cannabis clinics that are out there that are professional, that are reputable, and that may be able to provide me with answers to those questions. So would you be comfortable referring me to one of those clinics? And I think that's in general how I would counsel patients to approach their physician, especially if they think their physician might be reluctant to have that conversation.
So before I turn it to Helen, that question actually came up as well, Dr. Schecter. Do people need referrals to go to these cannabis clinics?
That's also a great question. And most clinics nowadays will actually see you without a referral from your treating physician. But I would encourage patients who are considering going to one of these clinics to speak with their physician first. Because if you go to a third-party doctor and they don't have your complete medical records, they don't have a complete understanding of what has been tried thus far, what you are currently using and the approaches you're taking, they might not be able to give you the right recommendations for you. So it's always better to go with the support of your doctor and ensure that your care is not siloed between different practitioners.
Okay. Helen, we've had an interesting question here about, is cannabis different in Canada than it is in the United States? I don't know if that's come up in your research, but somebody is wondering, is one better for pain control than the other?
Well, I think, I think it's fair to say that the challenges with medical cannabis is that you could have two different strains, let's say, that are called the same name and aren't necessarily the same composition. So on that level, I think I'd say that it's, and Daniel, you may weigh in too, but it's, unless it's from the same licensed producer, it's unlikely that a product that's produced in Canada is going to be identical to the US. And simply because of that reason, that it's not like, I mean, there's similarities to drugs, but it's not like a drug where we have absolute certainty with respect to how much, you know, if you've got a Tylenol, right? How much acetaminophen is in the Tylenol? We just don't have that certainty with cannabis. So I think the short answer is no, they won't likely be the same.
Okay.
And I'll say Canadian medical cannabis is by far superior because we have, not only because I'm a proud Canadian, but because we have a federally regulated system that is monitored and implemented by Health Canada. And that means that any product that is sold either to medical patients or on the recreational market has gone through thorough testing, and you can be guaranteed that it is pure of contaminants that include mold, pesticides, heavy metals, and fungus. So, and what is on the package in terms of the label is what you can expect to find in the package. And because the United States does not have a federally regulated system, each state is quite different.
Okay. So I'm just looking at the time. I want to thank you, Dr. Schecter and Helen, for providing all of this important information today. If you did not hear your question asked, please do email us at arthritistalks@arthritis.ca, and we will do our very best to answer them, as well as all the ones that we see right now in the Q&A. The video and presentation slides will be emailed to all registered participants this weekend, and the recording of this webinar will be posted to our website. We'd like to take just a few moments to get your feedback on today's presentation. So those of you on a laptop or desktop will see 2 poll questions come up on your screen with yes and no answers. So please click on the response that reflects your thoughts. The first question, have you had any challenges accessing your medical cannabis over the last 6 months? And the second question, did you find the information in today's webinar helpful to you? So we will be sending an evaluation form when we send out the video. So if you're unable to access the poll questions now, you'll have the opportunity to offer feedback at that time. Once again, we are grateful to Apollo Cannabis Clinics, the Government of Canada's New Horizons for Seniors program, United Way Winnipeg, and the Province of British Columbia for their financial support of this event. We invite you to support us as we raise $1 million and 1 million voices for 6 million Canadians living with arthritis during Arthritis Awareness Month. The Arthritis Society has a number of opportunities to get involved this month, including Rock the Joint, a virtual music showcase on September 24th, our upcoming Arthritis Talks, Road to a Cure on September 30th, and our ongoing Move Your Way fundraisers. We also invite you to like us on Facebook, Twitter, and Instagram and share the important messages we are putting out this month. We will be concluding the Arthritis Talks portion of the webinar momentarily. We do encourage you to visit Apollo Cannabis Clinic's virtual information booth, where Arash Tagve, Manager of Clinical Affairs with Apollo, will be available to answer your questions about how Apollo might be able to support you. And of course, you will also have the opportunity to put your name in a draw for an interesting takeaway grab bag. The link is on the bottom right of your screen below the chat, and we've also posted the link within the chat. This concludes Arthritis Talks, Strategies to Manage Your Pain. On behalf of all of us, thank you for joining us, and please do stay well.